Good afternoon, everyone. My name is Alicia Elias, and I am here with Stilly Valley Health Connections. I want to thank you for joining us for our Lunch and Learn series with the Washington Poison Center. For everyone joining us live, please note that this class is set up as a Zoom webinar. This means that all participants are muted and your videos are turned off, so we can record the presentation. If you would like to leave any questions or comments, we encourage you to do so by using the chat or Q&A box at the bottom of your screen. Thank you for being here, and thank you for everyone who has joined us for this class so far. Now I'll pass it over to you, Alex, who will be presenting today's topic.
Perfect. Thank you so much. Hello, everyone, whether you're watching live or, the recording from the future. Thank you for being here. And I'm just going to dive right in. So my name is Alex Sirotzki. I use he, him pronouns. I am a public health educator with the Washington Poison Center. I'm going to cover quite a bit of information today. So I'm going to dive right into poison prevention and medication management. So this is the our little agenda for the day. So I'll talk about the Washington Poison Center, what our services are first. Then we'll go through some household poisons, household chemicals, other household exposures, kind of a small category there. And then we're going to have the rest of things focus on medications, errors, and how to prevent them. So, the Washington Poison Center, this is our mission statement to prevent and reduce harm from poisoning through expertise, collaboration, and education. And I like to share this to show that, we love partnering with folks whenever we can. So, Stilly Valley, thank you so much for being such a multi-year partner at this point. And we also really embrace prevention and harm reduction and treatment whenever possible. The one bit of homework I'm going to assign you if you're watching this live or the recording is put this number in your phone. 1-800-222-1222. This is the National Poison Helpline. Call this from anywhere in the country. It'll route to your regional poison center. It's completely free. You're never going to get questions about billing or insurance. We're literally always open. You can call right now. You could call at 4 in the morning and someone is going to answer that phone. We are absolutely a confidential service. We're not going to try to get you in trouble. If you left cleaner out and a child got into it, we're not reporting that to anyone. We're just trying to keep the caller and the patient safe from any sort of potential poison exposure. We also have a language line, so interpretation services we can pull into any of our calls. Also a free service. Last year, the Washington Poison Center also opened up a text line, so 206-526-2121. Feel free to text that number between 11 a.m. and 6 p.m. every day. We also have an online chat available. You can go to www.wapc.org. There is a little online chat feature. The text and the online chat route to our call taker, so they are handling those numbers. They will encourage you to call if it is a more complicated case because it is a much faster turnaround time over the phone than in a text format. Now, when I talk about poison centers, I got to talk about poison. So for us, a poison is literally anything, any product or substance that could be harmful if it's used the wrong way, by the wrong person, or in the wrong amount. So that includes a lot of household products. That includes plants, cleaners, disinfectants, bites and stings from insects and animals and critters. That also includes medications. Medications can be incredibly therapeutic when we use them correctly. They can be incredibly harmful when we use them incorrectly. Now, you can call the poison center in a poison emergency, but it could also just be to ask a question. If you have a new medication, you want to make sure it's safe to take with the supplement you're on, especially if it's late at night, your pharmacy's closed, your doctor's office is closed. Give us a call. We're happy to help prevent something from going wrong if we can. You can call about yourself, you can call about another, and there we get calls from folks of all ages, or for folks from all ages. Now, if you ever do call us, one of our spies or specialists in poison information is going to answer that phone. I am not answering that phone, but our spies, our call takers, are nurses, pharmacists, physicians, and other poison information providers. We also interface very regularly with our board-certified medical toxicologists, and we have full-time medical toxicologists who work for us. Now, in 2025, we helped over 65,000 patients. We had nearly 130,000 calls helping these patients. So that is a lot of calls. We'll often do follow-up calls whenever possible to check in, make sure things are still going okay. Now, when folks call us first, we're very likely to keep them at home, keep them out of the hospital and out of the emergency room. About 90% of folks who call us first, we're able to keep at home. That's helpful because that saves time, that saves money, that frees up a bed in the hospital that doesn't need to be occupied. Um, we get a lot of our calls from folks at home, at work, at school. That's anywhere from 75 to 80% of our calls. The other 20 to 25% actually come from healthcare facilities, hospitals, paramedics arriving on scene. And I share that so that you know that you're getting the same expertise that the experts get when they call us. Like I said earlier, we take calls for folks of all ages. Around half of our calls are for little kids, kids under the age of 6. But we get calls for teens, adults, and older adults as well. As a general rule, there are absolutely exceptions. The older the patient, the more clinically severe those cases may be. A lot of that has to do with medication errors. So we're going to talk about that toward the latter half of the presentation today. Now, this little chart just shows when to call us at the Poison Center versus 911 versus 988. So you can call us, like I said, in an overdose situation, in a potential poisoning situation, if someone was exposed to a household product, a household chemical, if there was a medication issue, also just to ask a potential poison related question. We encourage you to call 911 following an overdose situation if the person is not conscious, they're not responsive, they're not breathing, or they're having a seizure. If those don't apply, if they are conscious, they are breathing, they're not having a seizure, we would say call us first following a potential poisoning or overdose situation. And of course, 988 is there for mental health crises and emergencies. Now, please hit me with any questions as you have them. I have both the chat box and the Q&A box open, so I'll be monitoring these throughout. But I'm just going to keep on going. So let's talk about household poisons. Let's talk about some common reasons for poisoning. Why do poisonings happen? Now, a whole heck of a lot of it has to do with a lack of supervision, especially for kiddos. Little kids are curious. They explore the world by trying to eat everything, putting everything in their mouths, causes us all a great deal of stress in those moments. We also see a huge shift in poisonings anytime we have a change in our routine. So travel can be a really, really, really common setting where folks have an accidental issue with a potential poison or medication. Seasonal risks too. A lot of times folks are out hiking, for example, more in spring and summertime, and they may be more exposed to critters that may bite or sting. Medication errors can go awry in so many contexts. While traveling is a huge one, so much of proper medication management involves memory cues, and our memory cues are all over the place when we're out of our routine. Um, Alcohol and other impairing substances can absolutely increase the risk of a poisoning with a different product. Anything that impairs our judgment or our focus or our attention makes it easier to make a mistake with something else. And then we do track cases of intentional use of products. So that could be intentional misuse, intentional abuse. And I do want to acknowledge intentional abuse when we're talking about substances and drugs is stigmatizing language in the context of poison centers. Intentional abuse cases means that individual was seeking some psychoactive or intoxicating effect, and something went wrong with it. And then, unfortunately, we do come across quite a few self-harm or self-poisoning cases with the poison center. Now, when we're talking about child exposures, any pediatric cases, these are broad categories of substances that are some of the most common. Cosmetics are huge. Pain meds are also really big. And I think when you hear pain meds, you may think prescription painkillers, opioids, and the like. And yes, we do get exposures to those. But the most common medications we get calls for, most common substances really across the board, across all ages, are over-the-counter pain relievers. So your acetaminophen or Tylenols, your ibuprofens, and things like that. We get a lot of exposures, a lot of cases involving supplements, various herbal remedies. We get calls for foreign bodies or toys, cleaning substances, vitamins. I think folks see vitamins sometimes as a separate category from medications, and can assume that there's no harm from taking too many vitamins, and there can be, depending on the vitamin. Antihistamines can also be pretty common to take too many of. Plants as well. It's not listed here, but mushrooms. We can get a number of calls for mushrooms. We're in a very forage happy part of the country here in Washington. Various topical preparations. That means lotions, balms, ointments, things like that. And then we do get a number of cannabis exposures. Now, almost all of our calls, especially for little kids, almost all of these kinds of poisonings are preventable if we store something correctly. So you may notice this little green fella, this kind of sticker showing up on this image here on some of these products. That is Mr. Yuck. So Mr. Yuck, folks may be familiar with. He's a kind of a poison prevention mascot. Washington Poison Center still uses him. Um, the way we encourage folks to use Mr. Yuck, especially if there are kiddos in the home, we provide stickers for free. You can go to our website, go to the materials order page, and we'll just send them to you for free. But place those stickers on the more toxic products in your home and reinforce that with education. That if you see this green guy, if you see Mr. Yuck on a product, it means don't touch without an adult you trust, because it could be toxic. It's really important to couple that the use of Mr. Yuck stickers with that education. Otherwise, you're just putting a fun cartoon character on a product. Now, a little bit about household chemicals. This is a super duper broad category. We have cleaners and disinfectants, detergents, pesticides, all sorts of things. I did a very broad poll for data poll for our number of cases in Washington last year, and I tallied over 4,600 of these household chemical calls or cases to the Poison Center. Some prevention tips. When you're using any chemical, wear gloves. Just put on gloves. That can really help reduce any sort of reactions we might see on the skin. Ensure proper ventilation. This is huge, especially with certain cleaners. Certain chemicals can release quite a bit of fumes. Folks can get lightheaded and get pretty sick depending on the chemical. So open windows up, make sure that it's a well-ventilated area. Read and follow all directions on all products you use. This slide is specifically on cleaning products, household products, but this is really true of everything. Read the instructions. Pay attention to the dose. Pay attention to how much the product recommends you use. Remember that more concentrated products are not necessarily better or more effective. They're just more potent. And only use products as they are intended. Also, keep in mind, don't mix cleaning products. These ones in particular, bleach and vinegar, bleach and ammonia, bleach and rubbing alcohol, and hydrogen peroxide in vinegar. All of these can produce some really scary gases that can make us quite sick. We found in 2020 and 2021, at the beginning of the COVID-19 pandemic, we saw a huge increase in our calls involving cleaners and disinfectants. And one of the bigger categories were folks mixing products and creating these harmful gases. Now, if you aren't sure what is safe, please call us. Again, we love preventing something before it goes wrong. And if you've ignored what I said and you mix these products anyway, still call us. We're not going to shame you. We're not going to judge you, but we are going to provide that kind of education. We're going to let you know what to do to stay safe in that moment. Also, and you're going to hear me talk about this a lot today, safe storage is huge. So for cleaners, for chemicals, store products in original containers. Folks may be inclined, especially when they have got, for example, a big container of antifreeze. If that container is running low and they don't, they want to save space, they may be tempted to pour it into something like a wide-mouthed bottle, like a Gatorade bottle. Antifreeze is often fun colors, like blue, and allegedly can taste rather sweet. So that right there is just opening up the opportunity for someone to take a sip of that, assuming that it is a safe beverage to consume. So, store products in their original containers, label products, whether that's with Mr. Yuck stickers or any other form of labeling to help you and anyone in your home quickly identify what something is and what it isn't. And store products up high and out of reach, especially of little ones. A little bit just on some other household exposures we come across. Plants. We're in a very lush part of the country. We got a lot of plants here in Washington. Some of them can be pretty toxic, and some of them are totally fine. So teach kids to not pick or eat or ingest plants or mushrooms they just see growing. This is really important with mushrooms as well. We get a lot, like I said earlier, a lot of mushroom calls. Keep house plants out of reach of kids. And then use any sort of plant care products, insecticides and the like. Use those safely as well. Make sure you're storing those safely. Make sure you know what they are. And then learn to identify what plants are in your area, what is in your home, what is around your home. We've got a little list of just some common toxic and non-toxic plants on our website. You are welcome to check out. Bites and stings. We also get calls from bites and stings from insects and other critters. Just very, basic suggestion, especially while folks are out hiking or exploring. Wear long, loose pants with over the ankle boots. That helps protect the legs, protect the ankles. We are lucky in Washington that there are not too many concerning snakes. We are not like in Arizona or Texas, where there are far, 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 far more concerning snakes. We do have rattlesnakes in parts of central and eastern Washington. If you are ever bitten by a snake, rattle or otherwise, please don't attempt do-it-yourself treatment. Don't try sucking out the toxin. Don't try cutting things open. That causes so many more issues than helps anything. Definitely call 911 if you're experiencing any facial swelling, difficulty breathing, or someone you were with is losing consciousness. Otherwise, following a snake bite, providing you're breathing okay, you're communicating fine, feel free to call the poison center and we'll walk you through what to do. Okay, we're going to pivot now, have the rest of the session be focused on medication. Again, hit me with any questions as you have them. Now, I want to talk about some common causes of poisoning with medication first before we define different types of medication errors we see. Now this is regardless of any age. If anything affects your grip strength, that can make it more complicated to open certain medications. That can make it more likely that someone is going to remove child resistant packaging or child resistant caps and use just the standard screw on, screw off caps for medications. So that is something to keep in mind. If for some reason you need assistance getting into those child resistant containers, keep in mind alternatives that you could use if there are kiddos in and out of the home. Vision. Anything that affects our vision makes it a lot harder to read medication labels and any sort of related materials that come with them. It can also make it more difficult to distinguish those look-alike products, like I was saying earlier. Just some other examples of lookalikes you can see here. The Cord-Aid looks a whole lot like the toothpaste there. We have Fabuloso and Mr. Clean, and that can look a lot like the soda there. Nasal spray, nail glue, eye drops, ear drops, nose spray, super glue. All of these can have very similar containers. We do occasionally get calls where someone has accidentally put glue in their eye. So if that ever happens, give us a call. We'll walk you through what to do. any sort of cognitive changes, whether this is a long-term change or a short-term change. A lot of things can happen in the short term that affect our focus or concentration, our ability to pay attention. Um, Anything that causes these issues can lead to forgetfulness and confusion regarding medications and broader care plans. It also increases the risk of having an accident with non-pharmaceutical substances, so cleaners, other products that we've already discussed. And, this is especially true with older adults, but it is true really of any age category. We have, as a society, more medications present than we used to in the past. Having multiple medications that require multiple doses a day, often coming from multiple providers and especially specialty providers, can open up more opportunities to make any kind of medication error. Substance use can also increase the risk of falling into a medication error. Um, Symptoms from intoxication and symptoms from interactions between substances and medications can lead to drowsiness, can make us really darn tired, can reduce our ability to pay attention, can impair our concentration, can affect our memory, can make it easier to forget that we already took our dose of medication, can increase confusion. We talked about impaired vision earlier, and can alter our sense of time, our estimation of how much time has passed. This is important to consider for all ages. Oftentimes, when we're discussing substance use, we're talking about teens or young adults. We often don't use with older adults. And with older adults, there can often be a greater risk of everything I mentioned here due to age-related changes in the body. Our metabolisms are slower. Substances can lie. Mental factors can increase our risk of medication errors. So if your medicine cabinet, if your cupboard where you keep your medications looks like this, you should probably clean it out and do a bit of an overhaul. Holding on to expired or leftover medications that we don't need anymore can increase the risk of safe storage, whether that's an unlocked cabinet, whether that's something that's cluttered like this, can also increase those risks. Anytime we introduce a new medication to our routine, there is the potential for new side effects that we're not used to. There's the potential for new interactions with medications we're already on. And I'm using medications very broadly. I am also including supplements and vitamins in this category. We often think about interactions being between medication and medication. We don't always think about them being between medication and substances such as alcohol or cannabis, or medications in food. There are certain types of medications that interact with specific types of food. Things to keep in mind and things to talk to your doctor and pharmacist about. All right, so I've talked a lot about medication errors, but what are they? Now we have five broad categories. Um, Anytime there's the wrong dose or the wrong medicine itself, the wrong person, medicine is taken at the wrong time or the wrong way. These are all types of medication errors. Now, wrong dose is very simply the wrong amount. I took two when I thought I was supposed to take two. I was apparently only supposed to take one. The wrong medicine. It's hard for the medicine to do its job if you're taking the wrong one. If you We get a lot of calls for taking medicine that belongs to someone else. So that could be I accidentally took my spouse's or my roommate's medicine or even my dog's medicine. Medicines taken at the wrong time can have some issues as well. If it is a morning med that you take at night, that can cause other issues. And wrong way. So a lot of the times folks think about wrong way meaning like it gets into the body in the wrong way. And that, absolutely can happen. If you are supposed to ingest a medication that you inhale, for example, instead inhale, that can cause an issue. But what we see more often with wrong way is I was supposed to take it on an empty stomach and I took it after I ate. That's an example of wrong way. The three most common types of med errors we see at the Poison Center are wrong dose, wrong medicine, and wrong person. Now, I did a quick data poll earlier. This is for all Washington State for 2025. These are cases or number of patients involving the Poison Center. And I broke it down just by age category. And you can see we have medication errors in every single age group here. And we have, of course, so many more for older adults, because in general, older adults are on more regular medications than younger folks. Now, why are medication errors so concerning? Well, there is the potential for accidental overdose. When we hear this term overdose, it's very, very easy to assume that we're talking just about illicit substances. But overdose very simply means you're taking too much of any product. Um, Too much can mean a lot of things, but anytime you're taking more than is recommended, that can be a problem. Now, overdoses, you could technically overdose on water. If you drink gallons and gallons and gallons of water, it can be very dangerous. You can flush your electrolytes. That is not to say to not hydrate. Please stay hydrated. But I just use that as an example that we can technically overdose on anything. We see, I mentioned over-the-counter medications earlier. We get a lot of calls for over-the-counter medications. It can be very easy to overdose on those. Same with prescriptions, same with vitamins and supplements. What happens with overdose has a huge range. Sometimes folks are completely fine. Other times overdoses can be fatal. Now, drug interactions, this is very simply when a drug alters the effect of another drug or another substance. So that could mean it could change the effect, it could cancel out the effect, or make those effects more intense. Now, with wrong dose and wrong time errors, we often see increased or longer lasting side effects. So we can see an increased level in confusion. We can see a less alertness than normal, a lowering of blood pressure, or even longer lasting sedative effects. For wrong medicine, wrong person, and wrong way, we can see brand new side effects that we haven't seen before. We can see brand new drug interactions we haven't seen before. And interactions can also occur with existing medical conditions and can intensify some of those conditions. Now we're zipping through this pretty fast, so I'm going to take a pause for just a second, have a sip of water. Please hit me with questions if you have any. I'm happy to pause for a moment and address anything that's come up. All right. Well, I'm not seeing an explosion in the Q&A box, so I'm going to keep chugging along, but we may finish a little early today. All right, so I have talked about safe storage a lot. Safe storage applies to medications as well. So we really recommend keeping medications in set sealed containers. So the original container or a pill box. Keep in mind, child resistant does not mean child proof. So child resistant caps does not mean a child can never possibly get into that substance, into that medication. My previous director once told me, Alex, if something is truly child proof, it's adult proof. Kids are crafty, kids are determined, and can often find ways through child resistance. All child resistant packaging does is it slows down how long it takes to get into that product. That slowing down increases the amount of time that someone else can intervene. So keep that in mind. That is the mechanism of action for safe storage, is that increase in time it takes to get into a product, allowing someone else to step in. And that is true regardless of age. We also encourage storing things, like I said, out of sight and out of reach of kids. Safe storage, as well as disposal, are super duper important. So we recommend not just relying on a medicine cabinet, which can also be kind of concerning. Um, Pardon me, medicine cabinets in bathrooms are not the best place to store medicines, which is counterintuitive because it's called a medicine cabinet. But Anytime someone is showering or bathing, they're creating at least some amount of steam, unless they're going full cold water, which I don't know many folks who do that. That steam can break down and shorten the lifespan of a lot of medications. Medicine cabinets also very often don't lock, so it makes it very easy for someone who should not be getting into that product to get into that product. So we one strategy we can use is to rely a little bit more on lock boxes, locking up prescriptions, bulk amounts of over the counters, as well as other concerning substances. We have a lot of rhetoric around a locked up liquor cabinet. We don't necessarily have that same rhetoric around locking up tobacco products, vaping products, cannabis products. One thing to keep in mind with lock boxes, combo locks tend to be more secure than a key lock, and internal latches are more secure than external facing latches. Disposing of meds you don't need anymore or expired meds is also very, very helpful. It's hard to have a medication go wrong if the medication's not there. And so this is one of many resources available in Washington State, medtakebackwashington.org. You can punch in your address there or your zip code, and it shows nearby drop-off kiosks. They also have a mail take back program for certain medications that they'll mail you an envelope. You load that envelope up with the medications that are approved for disposal that route and send it back, and they take care of it on their end. Like I said earlier, with cleaning products and household products, read labels, read instructions closely. And I know that can be very intimidating. A lot of medications have so much information there, but it's really important to know how much you are supposed to take, how often you are supposed to take it. It's important to know the maximum amount you should take at any one time, as well as the maximum amount you should take in a 24-hour period. Look at the amount closely. See if there's a decimal point involved. We get a lot of tenfold errors when someone has the decimal point in the wrong spot, or reads it in the wrong spot, I should say. Make sure you know the unit of measurement. A tablespoon is not a teaspoon, and a common kitchen spoon is neither. Common kitchen spoon is not a standardized unit of measurement. So for any sort of liquid medication, use the correct dosing cup or syringe. And use some sort of tracking system. Now, I'll talk about this in a few slides, but use some form of tracking system to log when you give medications or take medications. More on labels. I know it's kind of hard to see on this slide. It's pretty slow. But over-the-counter medications, just because it's not a prescription doesn't mean stuff can't go wrong with it. Not everyone is aware of how common acetaminophen specifically is. Acetaminophen is in Dayquil and NyQuil and Tylenol and so many cough and cold preparations. It is very easy to overdose on it without realizing, because you did not realize it was in all these different products you have taken. So be sure you know every ingredient in all of the medications you take. Now, keep in mind too, lookalikes apply to medications as well. This chart here shows a lot of common medications and candies that they can look a lot alike. So do your best to take medications out of sight of children. Children want to emulate the adults in their lives, and so they may try to take one of your medications to try to be more like you. It's really important to check the carpet and floors for any drop medications. This is a prevention strategy for kids as well as for pets. And then call medications what they are. Call medicine medicine. Don't call medicine candy. Don't call vitamins candy. So tracking systems, there are so many possible types of tracking systems out there. Folks who like using pen and paper can print off one of these from our website. There are many, many resources just for free out on the internet as well, to just jot down, I took this medication at this time. Folks can use different apps. There are so many different apps. Medisafe is one, and that's a free one, that can remind you when it's time to take your medication. Pill organizers can be very helpful for that physical tracking, but keep in mind they are not child-proof. So keep that pill organizer itself stored safely. Medication lists, creating and documenting these lists can also be very helpful to increase your own understanding of those lists, but also to create a packet to bring at any of your appointments to make sure every one of your providers knows all of the medications you take. And include using these lists, include vitamins and supplements and any other substances you use. And for me, I also see this as like an exercise in understanding your medications. The act of going through, reading through, and writing it down can really help lock in that understanding for a lot of folks. Safe storage can also include identifying what are your medications versus medications of anyone else in the home or in the household. So you could use different color bands or a piece of tape. I'll often put a piece of duct tape on my meds to differentiate them from my spouse's meds. Storing them in separate areas is also a helpful strategy. Using different colors of pill organizers is another strategy there. This is very broad, but we also encourage you to talk about substance use. This is with folks of all ages, and of course, there are age-appropriate ways to go about this. But a lot of the times when I'm giving a medication management training, it is two older adults or two folks who are helping take care of older adults. And like I said earlier, so much of our rhetoric around substance use is with teens and young adults in mind. We often don't think to talk to older adults about their substance use. And I don't say that in a way of like shaming folks for any substance use, but just knowing what substances folks are regularly using because there is that potential for increased impairment, increased intoxication, and interactions with medications they are on. Now, folks, we're very close to the end here. But if you ever do call the Poison Center, whether it's the Washington Poison Center or any others, this is some of what you can expect. We're going to ask you a lot of questions about the who, what, when, where, and why of any scenario. Now, keep in mind, if you are not comfortable sharing information with us, we're not going to deny you treatment advice. We're going to respect your privacy, but the more information you can provide us, typically the better treatment advice we can provide you. So we're going to ask questions about the patient's age, gender, weight, medical history, medication list. We're going to ask a lot of questions about the substance. It's really helpful if you have that substance in front of you and you can read from that container or label. We'll ask about the formulation, the strength, how much the person took, how long ago they took it. We're going to ask why it happened, how it happened, what time it happened, any symptoms that they are showing or have shown. And this is really important to answer honestly. We're going to ask, have you tried treatments so far? Now, a lot of the time, folks are going to say, well, I tried to induce vomiting or I induced vomiting. And that's one, it's a tricky one because poison centers, and other medical practitioners used to encourage to induce vomiting following a potential poisoning, but we no longer encourage that. There was a lot of research done over many decades that found typically that caused more harm than good. If something was damaging to the esophagus going down, sometimes it's more damaging coming back up once that product mixes with the fluids in your stomach. We also have a severely increased risk of aspirating. That's getting vomit into the lungs when we force vomiting or induce vomiting. So it is also important, though, that if you did induce vomiting, that you let us know that because and especially if we connect you to a hospital or paramedics, that's important for them to know because that they may alter some of the treatment they provide. We're also going to ask questions about the demographics of that patient. We're going to ask their name, their date of birth, the name of the caller, as well as a phone number in case the call fails and we need to call back. And then we're going to ask for a zip code. Now, again, it is okay for folks to not provide this information. We're still going to provide that treatment advice. Well, folks, we are getting through this darn early today, but this is my email address, a Sirotzki at wapc.org. You can also go to the Poison Center website, wapc.org, and there is a contact us form you can fill out, and you can check a box that says education, and that'll route to me and my fellow educators. I am part of a core service of all poison centers is education. That is always a free service. So please feel free to reach out to me to schedule an additional training session or ask that I help table at a tabling event. I'm happy to linger for a while and answer any questions that pop up. Thanks, folks.
As we are waiting for questions to come through, I want to thank everyone who joined us for this training today. If you're looking to do some spring cleaning of your medicine cabinet, the Arlington Coalition for Healthy and Resilient Youth is hosting a drug and vape take back day and mini resource fair. This awareness event is a crucial step in preventing accidental poisoning, drug misuse, and environmental contamination caused by the improper disposal of medications and vapes. Join us at Smoky Point Behavioral Hospital on Saturday, April 25th from 10 a.m. to 2 p.m. If you are interested in joining us next month with the Washington Poison Center, the Lunch and Learn session will focus on vaping trends, health impacts, and considerations. Vaping 101, Seeing Through the Haze, will be on Wednesday, May 13th from 12:30 p.m. to 1:30. You can find registration on the Stilly Valley Health Connections website or on Eventbrite. As you are leaving today's webinar, there will be a quick 6-question survey that will appear on your screen, and we would love if you could take a minute to let us know what you thought of this session and to share any feedback or suggestions for future classes. Awesome. Well, that is all that I have for now, but thank you all for attending, and we hope to see you in future classes. Thank you.
Thank you all. Bye.